everyone. Welcome to another amazing episode of Navigating Purpose with Temi. Today's topic is quite interesting and it's going to center around infertility. Infertility affects millions of people and impacts a lot of families and communities. The World Health Organization actually suggests that approximately 17.5% of the adult population, which is roughly 1 in 6 people worldwide, experience infertility. Those insights are staggering because that's about 6.7 million people worldwide. Today, I'll be speaking with a licensed consultant, obstetrician, and gynecologist specializing in reproductive medicine and infertility. So please join me in welcoming Dr. Arwa. Hi, Dr. Arwa.
Hi, Temi. Thank you for having me here today.
Yeah, sure. You're welcome. So just tell me a bit about yourself and, kind of what you do in terms of women's health, reproductive health.
Temi, I started my career in India and then moved to UK, and now I'm in the Middle East. So you can see 3 different countries I have worked in and gained a lot of experience across my career span, which is over 20 years now. And my main interest has always been in infertility. I got interested in infertility when I was actually studying for my gynecology exam in my final year of medical school. And like you said, 1 in 6 couples do suffer from some form of subfertility, which is a huge number. Over here at present, I'm currently working with Orchid Fertility and in Health Bay Women's Care. Orchid Fertility is where I do my IVF practice, and Health Bay Women's Care is where I do my general obs and gynae practice.
Oh, nice. Amazing. And just before we move on, there's a part of the podcast where the previous speaker leaves a question for the next guest. So the last guest or the previous guest left a question for you. And the question was, who are the voices that speak to you or speak to your world?
The voice that always speaks to me, I'll say, is my father. Because my father inspired me to be a doctor.
Yeah.
My father was a doctor. So right from the beginning, even as a child, I looked up to him, I admired him, and I wanted to follow him. And now that he's no more, I still want to make him proud that I'm his daughter, and he's the one who inspires me. And the next is my mom.
Oh, nice.
These are the 2 voices that always speak to me.
Yeah.
They've always supported me and backed me up.
Yeah. And is your mom still
My mom is still here.
Oh,
yeah.
nice. She's back in India or?
Yeah, she's back in India.
Okay. So let's get right to it. So in medical terms, what is infertility and how is it diagnosed?
Definition of infertility in medical terms is the failure to conceive after 1 year of unprotected intercourse in the absence of any reproductive pathology. Unprotected intercourse means that you're not using any condoms or any other barrier methods of contraception. Regular means having sexual intercourse at least 2 to 3 times in a week. And absence of reproductive pathology means there is no other condition which is deterring you from getting pregnant. How is it diagnosed? Is usually couples will come to us, after they've been trying for at least 1 year. Some couples do come earlier. And if they come earlier, I usually tell them, give your body a chance, because 80% couples will get pregnant within 1 year of trying. And 90% couples will get pregnant within 2 years of trying. So if you are young and, after 6 months you come to see me saying, I've been trying, I've not got pregnant.
Yeah.
I will still tell them, give yourself another 6 more months. See what happens. You will still get pregnant. And if that doesn't happen, then come back and we can start investigations. Baseline investigations is very important. So when you go to see a gynecologist as well for the same reason, then make sure that all the investigations are done. Don't jump into treatment before the investigations are completed. Because if you jump into treatment before investigations are completed and then you find out, oh, we didn't do this test and there's a problem over there, you already wasted 3-4 months. Baseline investigations will include a hormone profile. Look at your FSH and LH hormone, your thyroid, your prolactin hormone, because all of these can have an impact on your ovulation, your periods. And then if your periods aren't regular, again, you will struggle to get pregnant. Then do a tube test, very important. Make sure that there's no blockage in your fallopian tubes.
Okay.
right? So this is an X-ray which is done, or it can be done as an ultrasound guided test as well.
Yeah.
Where we inject a dye and then we can see the dye coming out through the tubes. So if the dye comes out freely, then you know that there's no blockage in your tubes. Also, there are studies that have shown that, once you do this test, which is called a hysterosalpingogram or an HSG, that itself can improve your fertility. I always give this analogy, so if you have been, if you've not been trying to get pregnant for 3-4 years, imagine a pipe which has not been used. It just collects rust, isn't it? Yeah. So inside the fallopian tubes, you have tiny, tiny hair, which are called cilia, and they produce mucus, which, helps to move the eggs and the sperms to bring them together, because pregnancy always starts in the fallopian tube. Then it makes its way inside the uterus. So if the tube is not being used for some time, maybe, it's going to get build up of that mucus as well, which can actually block the tube. So when you do the test, you flush the tubes out as well in a way. So you make sure that the tubes are open and you're flushing it out. And that itself sometimes can improve your chances of getting pregnant. And we have seen it, maybe it's anecdotal, but it does happen. And women get thrilled because, they didn't have to do anything. They just did one test and they've got pregnant after that. So doing a tube test is very important. Then we also advise women to have their AMH test or blood test done. AMH stands for anti-Mullerian hormone. This is an assessment of your ovarian reserve. Basically like knowing how much petrol is there in the tank. And for the men, it is very important to have a semen analysis. Whenever women come to see me, struggling to get pregnant, I always tell them, bring your husband along.
Yeah.
Because you want to have a baby as a couple. It's not just you who wants to have a baby.
Yeah.
Your husband should also be there, or your partner should also be there, because it's together that you want to have a baby. So there's no point just investigating the woman and then forgetting the man. So it's always important to investigate the man as well.
Yeah.
And for men, it's easy. They just need to do one semen analysis.
Yeah.
Ideally, when a man goes for a semen analysis, you should have 2 to 3 days of abstinence. That means no intercourse for 2 to 3 days, and then you go for the test. If you've had intercourse today and then go for the test tomorrow, then the sperm count may be low, so we may not get an accurate result.
Okay.
And if you've not had intercourse for more than a week and then you do a sperm test, again, we may not get an accurate result because there'll be a lot of dead sperms hanging around.
Yeah.
So you may get a low count again. So the ideal interval is, 2 to 3 days, no intercourse, and then you go for the test.
Yeah. So is it just intercourse, or are you meant to eat certain meals? Or I feel like I'm jumping the gun a little bit, but is it just intercourse when you're doing the test?
Yes.
Oh, okay.
Your diet will not have an impact as such.
Just at that point.
Illness. So say, for example, if you've had a cough or a cold and, you've just recovered from it and then you go for the test, that may have an impact. So if you're ill, and then you do a test immediately, your sperm count may be slightly low. But other than that, no other influence.
Right, perfect. And what are the common causes of infertility in men and in women? So we could maybe take women first and then go to men.
Overall, if you look at infertility, then, it's easier to put it in like tiny subgroups. So ovulation problems, 25% couples will have ovulation problems. Another 30% may be male factor, so where there is some problem with the sperms. Then another, 10 to 15% is endometrial, that is uterine problems. And then we have another group, which is 25% unexplained, where we do all the tests, everything comes back as normal, and these couples still are not getting pregnant. This 25% of unexplained category is the most challenging. Because as a couple, you think, all my tests are normal, and why am I not getting pregnant? So recent studies show that, women who have a low anti-Mullerian hormone level or a low ovarian reserve will usually fall in this unexplained category. So overall, and one more is tubal causes. So another 20% will be tubal causes. That means if there's any problem with the fallopian tubes, blockage due to surgery, infection can damage the fallopian tube, so that's another 20% of the couples.
Right.
So these are the general overall causes. So if you want to break it down now, ovulation, the most common cause for ovulatory problems is polycystic ovarian syndrome. Then you're looking at endometriosis.
Yeah, what is did you explain Is that PCOS?
Yes, PCOS is polycystic ovarian syndrome. PCOS is actually, I think it's a misnomer, because women who have PCOS, they think they've got these huge cysts on their ovaries. Actually, they are not big cysts. They're just tiny follicles and they've got plenty of it. When Stein and Leventhal gave the nomenclature, they didn't know what to call this as. So they just said they are cysts.
Yeah.
And that term has stuck since then.
Yeah. But I feel like an average lady, I mean, most of the people that I talk to, they always say, I have PCOS, I have PCOS. It makes my period super painful. And this is why I have, kind of infertility problems. I think I've heard that a lot with a lot of my friends.
PCOS is, it's quite common, I should say now.
Yeah.
I do think our lifestyle has had a huge role to play in PCOS. But PCOS is actually a hormone condition. Usual symptoms are delay in periods, oily skin, acne, excessive hair growth on the face, hands, legs, loss of hair in a male pattern. That means, you go bald, like how men...
Right,
men,
like in the middle.
Yeah, or from the sides, you know.
Yeah.
So male pattern baldness and excess hair growth, like men basically, because they have high androgen levels.
Yeah.
But the main issue is ovulation, because they're not ovulating regularly. So let me give you another example. For a woman who has regular periods, she has 12 chances of getting pregnant in a year. So for women who have PCOS, they don't ovulate regularly. So that's why they have late periods. They may be getting a period once in 35, 36 days, some women 2 months, some women even after 3 months. So for those women, from that 12 chances of getting pregnant in a year, it's gone down to 6 or 7 in a year, isn't it? So there you see, the first problem is the number of chances is already reduced for them. That's why they struggle. PCOS can be a huge challenge, even from a fertility point of view, to treat them, because they've got so many follicles on their ovaries. You want only that one follicle or 2 follicles to grow and release an egg.
Yeah.
So even when we give them medication, they are at a high chance of over-responding as well as not responding. So they can be a big challenge sometimes.
Interesting. And what would you say that are the causes of infertility in men?
In men, usually it is to do with the sperm count.
Yeah.
Okay, sperm count and motility. So if the sperm count is low, you can have a low sperm count and you can have a 0 sperm count. If there is no sperms at all, then you have to really investigate the man to see that is there a hormone problem. They can have high FSH, LH levels. That means there is a premature testicular failure. If men have had, cancer, if they've gone through chemotherapy or radiotherapy around the testicular area, then that can also, have a huge impact on the sperm count. Low sperm count will again need investigations. You check their thyroid, their prolactin, their FSH and LH levels to see, if anything could be corrected. But generally, if a man has a low sperm count, then they will need IVF treatment. If there is azoospermia, that means 0 sperms on the semen analysis, then we do check, we take a testicular biopsy, take tissue from the testis to see if there is any sperm production within the testis.
Yeah.
And if there is, then we can still retrieve those sperms and use them for IVF treatment. IVF stands for in vitro fertilization. It's very similar, isn't it? No, IVF stands for in vitro fertilization.
Yeah.
So in vitro is basically outside the body. In vivo means inside the body. So in vitro is because we're doing creating the embryos outside the body in the lab.
Yeah. So can you explain that further, just in terms of, in a very, very simple way? So you take the sperm and...
Let me explain. So basically, every month you release 1 egg.
Yeah.
Okay. So for couples who are struggling to get pregnant and they come to us for treatment, there are different forms of treatment, isn't there? But going to IVF specifically.
Oh, that's the one where you insert it into the woman, is it? No.
That's later.
Oh, okay.
So first we have to collect the eggs.
Yeah.
So we give them hormone injections so that the ovaries produce more number of eggs. Not eggs as such, follicles. We want the follicles to grow first.
Yeah.
And inside the follicle lies the egg. So we give injections to the woman. She takes those injections daily. And instead of that one follicle growing every month,
Yeah.
we will have maybe 10 to 15 depending on what her ovarian reserve
Yeah.
is.
Yeah.
And then once the follicles reach a good size, then we collect those eggs.
Yeah.
So that procedure is like done under sedation, can be quite uncomfortable. So we want the woman to have a good experience.
Yeah.
So we give them a mild general anesthetic and then do an egg collection. So we retrieve all the eggs.
Yeah.
Then the same day, the husband also has come to the clinic. He gives us a sperm sample, a semen sample.
Okay.
And then that semen sample is prepared in the lab. And in the lab, in a dish, we leave the eggs and some sperms around it.
Okay.
And then one sperm will swim and enter the egg and fertilize the egg.
Right.
And then that fertilized egg continues to grow and becomes an embryo.
Yeah. Yeah.
Later, around day 5, when the embryo reaches what we call as the blastocyst stage, we put the embryo back inside the uterus.
Okay. Okay. So IVF for men is basically taking the sperm of the man and kind of mixing it with the egg so that it
That's it.
catches. Okay. Perfect. Yeah, I'm learning. And I think just as we were talking, I thought that it would be important to also talk about the type of tests that people should actually take before they get married. Just maybe that might save them a bit of the kind of stress and worry that, they face when they're already married.
Usually, I will not recommend any detailed tests, from a fertility point of view. One good test is actually always to do is for the woman is to do an AMH. Know what your ovarian reserve is so that it doesn't come as a shock to you later on. And then once you're married, you can decide how much you can wait before you start trying for a family, or you'd need to get on and do it sooner rather than later.
Yeah.
So that's the only test I will recommend. Other than that, and for the man, it'll be always a semen analysis.
Yeah.
That's it. There's no other detailed test that I will recommend.
Yeah.
Because like I said before, initially, if you're young, especially less than 35 years of age, I will always say give your body a chance.
Give your body a chance, yeah. So typically, because I think you wanted to mention also that you wouldn't really recommend any test just because you give yourself that 1 year and most likely that happens. So the likelihood of you being infertile as a woman, would you say that it's slim before you get married?
You wouldn't know actually.
You wouldn't know.
You wouldn't know because you haven't tried.
Yeah.
Isn't it? Unless and until you try, you won't know. So
yeah, so
it's difficult.
Yeah, so it's either or. You can choose to do this EMH test.
Yes.
First, just to double check if you're the type that you're maybe a bit older before you probably got married, and you and your partner maybe want to start to try earlier, or like immediately you get married. So I think that would be something to recommend.
Definitely. AMH, especially for older women, over the age of 35, I will recommend that, do an AMH so you know where you stand. Do it sooner, do it later.
Yeah.
Try earlier or try later. So AMH is important.
Okay, perfect. And what would you say are some common misconceptions that you've heard around infertility for men and women?
Birth control. If I take birth control pills, it will, really cause problems with me getting pregnant in the future. Being on the birth control pill, even if you've been on it for 5 years, 10 years, it doesn't really impact fertility as such. Yes, once you come off the birth control pill, there might be a delay in getting pregnant for maybe 2 or 3 months. But overall, if you look in the long run, after 1 year, 2 years, 3 years, it is the same as someone who's never been on birth control pills or used other non-hormonal methods of contraception. So this is a huge misconception. Young brides, sometimes they want to delay, but they're so reluctant in taking the birth control pill because they think, it's going to impact my body. I will never get pregnant. So that's one common misconception. Second common misconception is IVF means if I go for IVF treatment, I'll definitely have a baby. IVF treatment is not magic. It is science, and there are limitations, especially when it comes to the woman's age and the semen factors and everything else. So don't be under the misconception that, if you've had IVF treatment, you are going to come out with a baby. It doesn't work sometimes.
Yeah. Would you say that there are a lot of failed attempts at IVF?
Yes. Because maternal instinct is very strong, Temi. Some women really have that strong instinct that they want to have their own biological child. And, they keep trying and trying and trying. And then at some point, we also have to tell them, okay, you've done enough. Look at other options now. Your body is not ready for, your body is not responding, or it's not worked. And there are other options which it's hard for women to accept because they still may be in denial. But we discuss with them, one such option is usually going for donor egg treatment, which in this country it's not allowed as per Sharia law. Or also, consider adoption. If you're in a different country, think about being a foster parent, or even these will fulfill your maternal instincts. And it's, you're going to benefit another child as well.
Yeah. To be fair, I feel like, just talking about this maternal instinct thing, a lot of women would feel very, very like insufficient, knowing that, they're not able to carry their own kids, and probably that makes them feel, very, very sad.
And incomplete.
And incomplete, yeah, which is probably what leads to kind of trying IVF over and over again.
Yeah, I agree. It's, if you've been in that position where you've been trying, and it's really disheartening. You're trying for a pregnancy, and, when your period comes and you see that blood, it's like, your heart sinks. And I can totally understand, I can totally understand these women having that, urge. But IVF is not, it's not a cheap treatment. It's expensive, it's a financial drain, and you've got to consider all of those. Plus, we are injecting high dose of hormones in them. And okay, you tried 2 times, you tried 3 times, 4 times. And sometimes, I think when we put our foot down, and as physicians, if we put our foot down and tell the women, I think it's enough, maybe it might give them closure, and then they try to look into other options
and other alternatives. Yeah, interesting. So what would you say are the common misconceptions for men? I would think, like when I think about it, I would say a common misconception is that the woman is the cause of the infertility problems, and it's never really the man.
Correct.
And yeah, so let's talk about that a little bit.
I was going to come to that the next, one common misconception is that, it's always the woman's fault.
Yeah.
But no, if the man has an issue with the sperm count, men can have erectile dysfunction as well. They can have problems with ejaculation.
Yeah.
So there are issues with men as well. And, that huge 30% is, 1/3 of the infertility couples are because of male factor, isn't it?
Yeah.
So, and also the other misconception is that, I ejaculate, so there should be a sperm. The ejaculate is basically a lot of, secretions which come from the glands around the testis as well, like from the seminal vesicles and everything. So although a man is ejaculating, doesn't mean that there should be sperm inside. Another example is if a man has a vasectomy. That means a vasectomy is a sterilization procedure in men, isn't it? So once they've had a vasectomy, they will still have an ejaculate. Men are so reluctant to have a vasectomy because they feel that, once I have a vasectomy, I will not have an ejaculate. It will affect my sex life, and my sex drive will go down and everything. But that's not true. You will still have an ejaculate, and that's one huge misconception as well. That as long as I ejaculate, there should be a sperm in it.
Wow, interesting. Another question that I wanted to ask was, and I think that ties beautifully into what we're talking about. How would you say that infertility affects couples mentally and emotionally?
It does affect quite a lot. like I said before, it is so disheartening for the woman. And sometimes, I have seen relationships break when couples have gone through IVF treatment because
Wow.
it's so exhausting and high anxiety levels. So I always tell couples, that you really need to focus on staying relaxed when you're going through fertility treatment. But even before they've come to us, they've been trying for that 1 year or 2 years and they've not been successful. So as it is, they're very anxious and they fail. Couples don't look out for methods or treatments to keep them calm, or to reduce their anxiety before they come to see us as well. And there are a lot of support groups available actually. Most of them are online over here, but I also feel that if you need to see a psychologist or a counselor just to talk about your fears and your anxieties around this, it really helps. If you're anxious, you will struggle to get pregnant even more. And then if you are relaxed, it is easier to get pregnant. Women who work in, high stress jobs,
Yeah.
even men for that matter, they're always traveling. It is difficult to be together. And here, I am telling them, have intercourse 2-3 times in a week. It's not possible for them sometimes. And that makes them more stressed, and it puts a stress on the man as well, because then they have performance anxiety.
Yeah.
They're not able to ejaculate or, not able to have an erection because they're so stressed about, having intercourse tonight because the woman has said, oh, today is my ovulation. I have to have intercourse tonight. So those anxiety, it shouldn't be there. Speak to someone. Join these online support groups that are available. It really helps. When you speak to other women facing the same issues, you will realize that you're not alone in this and you can seek help. Don't be scared for asking for help as well. I think a lot of women are so reluctant because they feel that they might be stigmatized because of this. They don't want to speak to anyone in their family. You don't have to speak to anyone in your family. Speak to a close friend or just be anonymous. Speak to someone anonymous on these online support groups.
Yeah, definitely. I think the stigma is really major. I have had, I mean, we're all growing. I've had very, very close friends kind of feeling very, very insufficient because of the infertility problems that they're going through. And I think it's also important to talk about age, kind of not age sometimes is a factor, but sometimes it's not a factor as well, because I'm seeing even more young people having issues with infertility. And by young people, I'm talking about people in their early 30s. I have friends that are 30, 31, in their 20s that are married and actually are having difficulties conceiving 2 years after marriage, a year after marriage, 3 years after marriage, or even having miscarriages as well. So I think there's definitely a stigma around it, and also a stigma around talking about those emotions and feelings with friends and with loved ones.
True, I agree. As you mentioned age, let me, give you a brief insight about how age has an impact on infertility. As a woman, you are born with all the eggs that you're going to release. Okay. Some may argue that, newer research is showing that, the ovaries are still producing new eggs, but that is still in the research setting. We don't have conclusive evidence of it as yet. So just to give you an insight, when you are inside your mother's womb, okay, at 20 weeks of gestation, that means roughly when the mom is around 5 months pregnant, your ovaries will have around 5 to 6 million oocytes. Oocytes are your immature eggs. By the time you are born, that number has already come down to 1 to 2 million. By the time you hit puberty, that number has come down to 300 to 500,000. So you can see there is such a huge loss of oocytes, okay? In your reproductive lifespan, that means from the time you start having your periods till you go through menopause, that is your reproductive lifespan. You will release only around 300 to 400 eggs.
Wow.
So each month, your ovary will recruit a certain number of oocytes, of which one will become the dominant follicle and you will release that egg. the other follicles that were recruited, they will die. So you lost them. So when we do this AMH blood test, we are looking at what is being recruited per month. So if you have a low AMH, that means your ovary is recruiting less number of eggs. That means you don't have much time. You know, for those, that is why AMH test is important. So for those women, you know, we will recommend that you start trying to get pregnant sooner rather than later. Don't delay.
Yeah.
More and more women, you know, are coming to us in their 40s now. If you look at, you know, what is the average age of women coming to fertility clinics, it's no longer, you know, early 30s actually. It is mainly late 30s and 40s. And like I said before, IVF, it's not magic. It's, you know, it doesn't guarantee a baby, because as you get older, you have to remember that your eggs are also getting older. You know, how the egg develops in the egg matures. You're born with the eggs, okay, but they are immature inside. And then when you are about to ovulate, that final step of maturation happens. But they are getting old as you get old as well.
Yeah.
So as you get older, then you struggle to get pregnant because the quality of the eggs is not good. And if you get pregnant again, the risk of miscarriage is higher in older women, going down to again to quality, because the quality of the egg is not good. So that is why in older women we see higher risk of Down syndrome and other chromosome problems as well.
Wow, interesting. Just to the point on age, you know, I read a research when I was preparing for the podcast that, you know, from when you're 35 onwards as a lady, your egg production or something also reduces further drastically, and that also affects
That's true.
how you can have a baby.
Yeah, that's very true, because there's a steep decline after 35 in your fertility potential.
And this is for men and women?
Usually women.
For men?
No, women.
Women, right.
For men, recent studies have shown that, you know, as men get older, the sperm quality also declines. Previously, we used to think that, you know, men even at the age of 65 and 70 can still father a child. But now we see that, you know, men as they get older, usually over the age of 40, you know, there is a decline in the sperm quality as well. So even for men, you know, don't be under that impression that even at 65 and 70, you can still father a child. He may also struggle.
And if there are issues with the quality of the sperm, say when a man fathers a child at that age, does it typically affect the development of the child?
That is difficult to say. That is really difficult to say, you know, because there have been so many studies about this to see whether, you know, children born through IVF treatment, you know, whether there are more problems in them, or compared to the general population or couples who have conceived without IVF treatment, especially going to the sperm factor. Really difficult to say.
Yeah.
You know, there was this huge Australian study which looked at basically just not particularly if there was a sperm factor, IVF treatment as such, you know, general population without IVF treatment and children born from IVF treatment. And they had, you know, a huge number of children in this study, and they did not find any major difference. But speak to my husband, who's a pediatric neurologist, you know, and he will say there's you know, more autism in children born through IVF treatment. But I cannot say for sure. You know, the evidence is still 50-50 in it.
Right. And what role would you say that nutrition plays in infertility and infertility treatments?
Nutrition plays a huge role. We want couples to be healthy when they come for treatment. Okay, another example. Think of IVF as, you know, an investment. You're investing in the future. When you put your money in something, you want a good return, isn't it?
Yeah.
You don't want your money to go down the drain. So when you come to us, you know, for treatment, and I see that the man and the woman, you know, both have an unhealthy lifestyle, smoking, alcohol, high BMI, no exercise. the chances of success are going to be low. Studies have proven that, women who have a BMI of more than 35, your success rates are much lower as compared to a woman who has a normal BMI. Even for the man, high BMI, low sperm quality, high DNA fragmentation. So, improve your lives, improve your health. And that's when nutrition plays a role, Avoid eating junk, eat good, nutritious food, fresh food basically, rather than tinned and processed food. And we eat, Dubai, there's no, food is surplus over here in abundance, and it's so easy for a working couple, not to have any home meal and just order from outside, and that's not healthy, to do it day in and day out. So nutrition, good nutrition, balanced diet is what I will say. Balanced diet and exercise is very important when you're going through fertility treatment. And if your BMI is high, reduce your BMI, bring your BMI down to normal, stop smoking, reduce your alcohol intake. I'm not saying, cut it down completely, but it should be in the recommended allowance, which is 10 to 12 units per week for a woman and 12 to 14 units per week for a man. As long as you stick to what is in the recommended range, then you're fine for alcohol. But smoking has a huge impact. Smoking affects sperm, smoking affects the eggs as well.
Yeah.
So if you're smoking, then I will strongly suggest that, quit smoking, even vaping. Because at the end of it, even vaping, there is some amount of nicotine there. It's not, it's the nicotine actually which can affect the sperm quality. Nicotine causes vasoconstriction, so it reduces the blood supply, isn't it? So that's why we want them to be off it.
Yeah, and BMI stands for body mass index.
That's
yeah.
right.
And what is a healthy BMI in male and female?
Healthy BMI for both male and female is between 18 to 25.
Okay.
And then 25 to 30 is overweight. 30 to 35 is class 1 obese. 35 to 40 is class 2. And then 40 and above is morbid obesity.
Wow. Interesting. And another question that I wanted to ask is what treatment options are available for infertility?
Okay, there are different treatment options, and you don't have to jump into IVF or in vitro fertilization straight away, all right? So you come to us, you're struggling, we do the baseline test, we find out if there's a problem. If there's a problem, then we treat you accordingly. But if unexplained, no reason, then you can try ovulation induction, especially for women whom we know that are having problems with ovulation, not releasing an egg per month. Then we can just give them tablets like clomiphene or letrozole. Make sure that they are producing a follicle and releasing an egg every month, and then we ask them to try naturally with that. So that's ovulation induction. If that doesn't work, then there's another treatment which is called intrauterine insemination. Intrauterine insemination is basically we give the woman the tablets or injections to make sure that she produces a follicle and releases an egg, and we time the release of the egg. So give the trigger injection to release, to make sure that she ovulates, and then around that time the husband will come to the clinic as well, gives us a sperm sample. We prepare and wash the sperm sample in the lab and then inject the semen sample directly inside the uterus. So basically all we are doing is bypassing any factors that may be in the cervix preventing pregnancy, bringing the sperms closer to the ovary or the egg. Because once the egg is released, the fallopian tube will capture the egg, and the egg comes inside the fallopian tube, and we've deposited the sperms inside the uterus, so they don't have to swim all the way from the vagina into the fallopian tube, so they're very close, so thereby just increasing the chances of getting pregnant. When it comes to tablets, Tami, a lot of I have seen a lot of couples taking tablets like clomiphene and letrozole month after month, without any success. There is a limitation to how many months you can take these tablets as well. And this I'm saying just to, create awareness, because I know a lot of women are even buying them over the counter, taking them without a prescription, having basically no monitoring. It's not an easy fix again, just take clomiphene and, or letrozole and you will get pregnant. There is a limitation because you can't take these for more than, 9 to 12 months maximum. So if you've taken the tablets for 6 months and nothing has happened, then it is time to move to the next step. Either consider IUI or maybe consider IVF treatment. The theory behind why you cannot take these tablets for very long is of the risk of ovarian cancer. Theoretical risk, small risk, that it can increase the risk of ovarian cancer if you take these medications for a long time. That is why guidelines have been put in place to limit the use of these drugs.
Wow, interesting. Really interesting, actually. How do people know what treatment is right for them?
That will depend on the causes.
Yes.
Okay, and the discussion with the physician. Because once we know what the cause is, say for example, if there's a tube problem, then ovulation, induction by giving them tablets, it's no point because the egg and the sperm aren't going to meet. So for those couples, that they need IVF treatment, and then they should get on with that. Okay. If there's a sperm issue, sperm count is low, they may struggle to get pregnant. Again, for them, better to move forward with either IUI treatment where we are preparing and putting the good sperms inside the uterus, or move forward with IVF treatment then. So for the couple to decide, as to what is the best treatment for them, it is to have that discussion
with their
physician.
Yeah.
Also, don't blindly follow. Ask the question, why? Because so many times I have seen couples coming to me who have been to other physicians and then just, done, whatever they've said. And then I ask them, why did you do this? Like, oh, the doctor told me. I know, we also have your best interest in at heart always, but ask, why I'm doing this, why are you doing this? Understand the physiology as well behind it, because it makes it easier once you understand, what's happening with your body.
Yeah. Wow, that's amazing. I think this has been a very, very interesting conversation. I've learned a lot. But just before we kind of end the podcast, I wanted to ask if there was anything else that you wanted to share just around infertility to educate people and let them, just educate them about this topic.
There's one thing I would like to say, maybe slightly out of infertility as such. This is for young girls who are in high posts, very career driven, and don't want to think about having a family or getting married now. Because for those girls and those women, I will say, please consider freezing your eggs.
You're talking to me. You're speaking to me. Shots fired, guys.
Because, then you come to me at 40, you just got married and you say, doctor, I want to get pregnant.
Gosh.
And I was like,
yeah,
I struggle at that time, isn't it? So when you're young, especially, the best time is before the age of 35. Because like we said before, after 35, decline in the quality and fertility potential. So before 35, you'll have a good number, consider freezing your eggs. That's your backup plan. I'm not going to say that, at 40, we will not try IVF. We will try IVF. But if you struggle with your eggs at 40, you have your backup. Those eggs are not going to age. They are frozen in time at 35. You can use them even 10 years down the line.
How do you freeze your eggs?
It's the same treatment as going through IVF treatment. You still have the injections to stimulate your ovaries to produce more follicles. And then we collect the eggs and we check if they're mature, and all the mature eggs are frozen.
Yeah, and it's kept in the clinic or the hospital?
It's in the clinic. It's in the clinic. It's they are cryopreserved in liquid nitrogen at a very high, -70 or something.
Is that an expensive treatment, would you say?
It is similar in terms of cost. It is almost half the cost of IVF treatment.
Okay.
Because you're not going through the process of creating an embryo, and there's no sperm preparation and everything involved. So it's roughly half the cost of IVF treatment.
Wow, that's interesting. I think a lot of people tend to not think about that, maybe because they feel that there's still time, or they don't want to accept the reality that there is a probability that, my eggs may not be as potent, if that's a word, may not be as potent. I think we're just in some sort of denial. I just feel like, I'm normal, I'm young, I'm energetic, and everything should work when I'm like ready to then have children.
That's true.
Yeah.
Very true. And that's why, when they come to us at 40,
it's too late.
It's too
well,
late.
maybe not too late, but it's a bit late in terms of the process, and it could be a lot more complicated.
More complicated. And also, like we said before, success is less, and then they have regret. Had someone told me about it. So now, we're creating awareness.
Yeah.
That do it, freeze your eggs earlier.
Wow. This has been a very, very interesting conversation. So in the episodes, you have to leave a question for the next guest. So yeah, leave a question for the next guest. I'm putting you on the spot there.
Yeah. I just have to think about this question now.
Yeah.
What advice would you give your daughter regarding fertility?
Wow. Okay. Interesting. Let's hope that the person that we're bringing on the next episode actually probably wants to have kids, or I don't know, or maybe the daughter.
Let me rephrase it,
Okay.
What advice will you give your children? Maybe not just daughter, it's the same for a man as well, isn't it? Regarding fertility.
Yeah. Okay, perfect. Well, thank you so much, Dr. Arwa. I've really, really enjoyed this conversation. I think that, overall, there's going to be more episodes coming out right after this around reproductive health. And I'm hopefully gonna bring you back to talk about the next topic, which is gonna be around miscarriages. But it's been an absolute pleasure having you on the show today.
Thank you very much. Thank you so much for having me.
You're welcome. Well, that's it, guys. I hope that you've learned a thing or two from today's episode, because I have. And I look forward to joining you on the next episode, where we're going to be talking about miscarriages. Look forward to seeing you soon, guys. Bye.